Right, on to that new feature, Medical Matters. Between 800 to 1,000 South African children are diagnosed with cancer annually. However, it's estimated that half of the children with cancer in the country are never actually diagnosed. 2/3 of children with cancer never reach a specialist treatment centre for treatment in the country. The majority of those that present are in advanced stages of the illness, and these are stats according to the Cancer Association of South Africa. So as part of our focus on medical matters, this morning we take a closer look at childhood cancers, from the early warning signs, access to treatment and management. Lisa Wilson is at the Hani Baragwanath Academic Hospital's Pediatric Oncology Clinic in Soweto, Gauteng. Let's cross over to her. Lisa, once again, good morning to you.
Leanne, good morning. Thanks again for joining us, obviously, at this hour. Again, Medical Matters Monday, and we're shining a spotlight on childhood cancer treatment in South Africa. Just some of the strides that have been taken, but obviously also the gaps and challenges that remain. As you aptly mentioned, we are at the Hani Baragwanath Academic Hospital in Soweto, Gauteng. It is the largest hospital in South Africa and on the continent at large. And today, the Oncology Research Clinic is obviously just behind me. It's been launched, and we're looking at the significant role that this is going to play with the ongoing advancement when it comes to childhood cancer treatment, and obviously just looking at ways to improve the reality of the day in South Africa on the ground. So to take this discussion further, Dr Nthabiseng Makgana is the CEO of the Hani Baragwanath Academic Hospital. She'll be joining us to chat a little bit further. Dr Nthabiseng, good morning, and thank you for joining us on the SABC at this hour. Firstly, congrats on this feat. We're obviously looking at the role that it's going to play in South Africa and the advancement of research at large. Talk to us about the significance of launching this research centre.
Well, a very good morning to you, and a good morning to the listeners at home. I think one of the most important things what this research centre has actually shown us is an issue of collaboration. We did not do this on our own. There is a foundation called the Stanley Nkosi Foundation that so graciously afforded us this building. But this then means that we can advance the healthcare treatment of those that are disadvantaged. As you can see, we are in Soweto. The most disadvantaged of people actually gain access to healthcare, which is top-notch.
And so speaking about access and even volumes of people that visit this or frequent this centre, it's not limited to South Africa, it's not limited to Gauteng alone or South Africa. Talk to us about the impact it's going to have for SADC at large as well.
Absolutely. As you had rightly said, that Hani Bara is actually the largest hospital, the third largest hospital in the world. So we actually see close to about 600 patients per annum just in this place. And these are not confined only to South Africa, but to the SADC regions. And we provide the service to say that if this is a center of excellence, let it treat all our Africans.
These strides that have been taken have to be applauded, but there obviously, as I alluded to earlier on, have been some gaps. The Public Protector's report, the office, in fact, just highlighting some of the systemic issues that need to be addressed. Talk to us about what was unearthed on that front, how you've also mitigated against some of those.
All right, so one of the things that we have spoken about is actually primary health care. That's where health actually starts. And primary health care is actually out there in the community. And we have then, as Hani Bara, decided to do important work, which is outreach. Outreach to schools, that's important. Outreach to creches, that's also important, to communities. But also, as our prof said earlier, the teaching of what it means to look at early warning signs so that our patients don't come here when it's too late. So outreach is the word.
You also spoke about collaboration, and I mean, as much as it's going to benefit patients, particularly childhood children with living with cancer, oncologists also have to come on board. You've got researchers as well. Talk to us about some of the collaborations, at the work in essence that's going to be occurring here.
All right. I think what's important about our name, you will note that we are Hani Baragwanath Academic Hospital. So there is already a collaboration, especially with the Vet School of Health. And these are the ones that are actually running in terms of research, in terms of making sure that we have data, in terms of making sure that we understand the outcomes and what is new in the market, what actually works for childhood cancers. We've noted that our children actually are much better than adults because their immunity actually responds better than in the adults.
I just wonder, as we conclude, in terms of time now, I wanted to look at some of the contributions that we will be making to that scene, perhaps also to the world scene. Talk to us about South Africa's contribution through the centre.
I think what's important is that we will then feed into what the world knows about childhood cancers. We've noted that the European, when it comes to data, they are stronger than in Africa. So when we come together as South Africans, because this is one of the largest centres that we have for childhood cancer, it means that the papers that will be published will actually be world renowned, and they will speak about what Africa can offer.
I know that funding as well as affordability is one of the issues that we grapple with in this country when it comes to cancer treatment. I'm just looking at inequalities and inequities as well, given the past. I wonder if you could speak to addressing some of those challenges through this initiative and through this clinic going forward.
I believe that this initiative actually brings together not only the private sector, but it also brings the public sector. We're able to collaborate together. So we don't discriminate whether you're a patient with medical aid or not. And it just talks about accessibility once again. And again, the conversation will then move towards NHI, which also talks about the two-tier system that we're having. But we are saying, let accessibility not be bound to your pocket, but let it be bound to actually the region that you're in. You should not be bound because of the money that you have.
No, absolutely. I also just wonder, going forward, when we're looking at the NHI and some of the proponents of it to date, I mean, we know that it's going to be signed in, and we're looking at how perhaps, oncology is also going to be addressed, because it is an expensive feat, especially for people South Africa, given their circumstances. We cannot really afford that. How do you think this is going to mitigate against some of those challenges as well?
I think what's important is that we'll then be able to collaborate, and the access will actually mean that it doesn't matter where you're coming from. But if there is medical, if there's medical provision that can be given to you, whether you're from Gauteng or whether you're from the Western Cape, if it is in this place, it should not then cut you off. So NHI will mitigate that gap between the underprivileged and the privileged. And we're saying there is a right to healthcare, you have a right to access, and that's the underpinning.
No, absolutely. Obviously, we just arrived here this morning, and we see some patients. For those who are not privy to whether this is not operational or not and how they access it, I mean, talk to us a little bit more about that launch and how many patients you've already seen, treatments that's currently underway as well.
So we are live. We've been live for quite some time. And as you said, that we do have patients. And we actually have patients that are also admitted. We've done something that's remarkable, which is stem cell transplants. Something that is world renowned, that is not done anywhere else. And we've actually done it here at Chris Hani Bara. So there is a couple of patients that we've actually seen that have come out positively, and now they are cancer free because of this initiative.
I wonder if we could just also look at the value chain at large, because as much as there is treatment available, early on we were speaking to Prof. Gita, and I was trying to understand the difference in treatment and accessibility with regards to childhood cancer treatments versus adult treatments. And I just wonder, if you're incorporating lifestyle elements, if we're incorporating, other issues along the value chain. Talk to us about the reality that one needs to face in undergoing such a journey, particularly for childhood cancers at large in South African context.
I think for children it's a bit different as compared to the adults. The adults, it's more about lifestyle and we can do prevention. But for children, it's very difficult because some of them can at 1 year or 18 months come with a nephroblastoma for some reason. But you can't literally prevent that. But as we spoke about the early signs, what is it that you actually look at? And that's what Prof was actually talking about. Unlike adults, with adults, we're able to talk about lifestyle, we're able to talk about the genes that you might have, we're also able to talk about medications that we're taking. How do we prevent making sure that we have sunscreen at all times so that you don't get skin cancer, for example. So for children, it's a little bit different as compared to the adults.
All right. Dr. Nthabiseng, thank you for joining us at this hour. We'll leave that conversation there, for being part of these pertinent discussions happens on our Medical Matters Monday edition. Leanne, I'm going to leave it there for now. The CEO of the Hani Baragwanath Academic Hospital, Dr Nthabiseng Makgana, chatting to us about the Oncology Research Clinic, obviously, that had been launched here at the Hani Baragwanath Academic Hospital. Treatment, affordability, access, just also strides that have been taken, pioneering some of the research for cancer childhood treatment at large. So we'll leave it there for now. I'm going to hand it back to you in studio, and we'll chat next time.